We're in muscle 4. So muscle attached to the bones through the tendon, and the attachment point called the origin and insertion. Origin is the one closer to your body, so it moves less. Insertion is one further away, more distal, and it moves more. So the origin and insertion, two attachment points. And skeletal muscle, when it contracts, it brings a bone closer to the other bone. It creates movement. So the skeletal muscle always attached to different bones. And between bone and bone, we call it joint. So skeletal muscle come across at least one joint. Sometimes it come across two, like this one called sartorius. That's the longest muscle you have in your body. Actually come across two joints, your pelvic joint and your knee joint. And muscle will organize in fascicles. Fascicles are those bundles of muscle fiber together called fascicle. And those fascicles can arrange in different patterns. They can arrange in the circular pattern. And these muscles were named by the circular pattern called orbicularis. Like orbicularis oris, that's the muscle surround the mouth. And also sphincter. Sphincter are those muscles in your GI tract you find a lot, and they have those circular shape. They can organize in parallel structure, and like the belly muscle called rectus abdominis. Rectus is the shape is flat. Abdominis tell you is in this area. They can converge. When they converge together, like your pectoralis major, and that's the muscles in your chest. And sometimes they'll organize in another structure called pinnate, and it's a lot of fascicles put them together. And you can have single, you can have multiple pinnate, like the deltoid. That's one example. And some small muscles only have one pinnate, like the unipinnate muscles, extensor digitorum. So that's the muscle used to extend your finger. Muscle with bipinnate, that's the rectus femoris. That's the muscle in your thigh. If you like cycling, that's the main muscle. Or you can have more than two, and that's the deltoid. And the muscle, when they contract, it becomes shorter, so they have the range of motion. And they also produce the force, that's called the power. And some muscle can be shorter up to 1/3 of their length, like your deltoid. If you want to show your biceps bronchi, that's the muscle in your arm. You want to show off the muscle, you contract the muscle, and they become shorter and become bigger. And the muscle power really comes from the muscle fiber. So the size really matters. Compare the big muscle with the small muscle. Apparently the big muscle have more fiber. And when they have more fiber, they produce a bigger power. So your leg muscle are stronger than your arm muscle in general because they are bigger. And muscles, these two muscles, they work in the same joint. They provide totally the update movement. We call them antagonist muscle and antagonist muscle. So the antagonist is the prime mover, like the biceps bronchi, and that's the main mover of your elbow muscle. So this is the antagonist. And the antagonist is the one, when they contract, it will extend the elbow. So they work in the same joint, but totally the opposite movement. So this is called the antagonist. And together, they are called the agonists, plural, agonists muscles in the same joint, but they create totally the opposite movement. So that's the bicep and triceps bronchi. And the next group of muscle is called the synergist. Muscle have layers, And in some joints that are important for movement, you have the bigger muscle like the biceps brachii create the movement, but inside when you take the biceps brachii away, inside is called brachialis. That's the small muscle create exactly the same movement of your biceps. That's smaller. And their function is assist the prime mover and also help to stabilize the joint. And because they're small and they're easier to be damaged compared with the big muscle. So the naming the muscles can use the location, like the intercostal muscle. This is the muscle between the ribs, and the inside one is called the internal intercostal. The outside is called external intercostal. These muscles are used for breathing. You can also use the shape of the muscle to name it, like the deltoid. Deltoid, that's the triangle muscle in your shoulder. You take a flu shot, that's your deltoid. And muscle have layers, also have different size, like a gluteus maximus. That's the biggest muscle you have in this area, and you have the minimus, the brevis. They're all in here. And sometimes they use the physical orientation to name the muscle. So you have the rectus muscle, it's a flat. And you can have the transverse muscle go in this direction, and oblique muscle, oblique muscle. Sometimes they use the origin and insertion to name the muscle. Let's talk about this one, sternocleidomastoid. This is the muscle in your neck, create your head movement. And the name is super long, but the name tell you where they attach. So start from the sternum, and clavicle, these two bones. It go all the way to the mastoid process of your temporal bone. So this muscle control your neck movement. It's called the sternocleidomastoid. And sometimes they use the number of origins, like you have the biceps brachii, you also have the triceps brachii. So these have 2 origins, these have 3. In your hand, you have the flexion extension movement. You also have the abduct, adduct, and those muscles use those movements to name them. To name those muscles. So you have the flexor digitorum, and the name tell you it flex the finger. Okay, now let's take a short break.